I am telling you some important items in dentistry according to the wish of Dr. Ferris Nazari, who is an endodontist in the United States, who has asked me to tell you to all of the dentists, orthodontists, and endodontists, and other specialties to preserve sixes as far as they can. And these points from now on I'm telling you are about preserving sixes. With greetings to all of my colleagues. I would like to introduce myself first and then talking about some important points in dentistry. I am Dr. Motamedi, graduated from Pahlavi University in Shiraz, Iran in July 1976. Pahlavi University at that time was affiliated with Pennsylvania University, and therefore our degree was approved in United States. Immediately after graduation, I was employed in Isfahan University School of Dentistry as an instructor in Department of Orthodontics. And 1 year later, on July 1978, I went to Temple University in Philadelphia, Pennsylvania, where I started my orthodontic residentship for 2 years and graduated on September 1980. In this long period, I was engaged in private practice also in the afternoons. And I have seen several cases of congenital enamel hypoplasia of first molars, which from now on I will call them as sixes. These teeth are erupting in the mouth in age 6 or 7. And most of the parents think that this is a deciduous tooth, as it's erupted behind the second deciduous molar or ease. Those sixes which have enamel hypoplasia will receive caries immediately. And this caries will progress and most of the time will lead to breakage of the walls of the tooth. And finally reach to the pulp. And this is the time where the kid feel pain, and that is the time where the parents show their kid to the dentist. Almost all of the dentists at this situation decide for sixes extractions, whereas the right decision is that to introduce the kid or refer the kid to the endodontist for root canal therapy, or if needed, apexification, and then building up the crown. And finally, at age 18, the kid received the permanent crown. When the endodontist says that this tooth is hopeless before extraction, you should consider some points. When you extract the six, only you are eligible to extract a sixth tooth when the opposite tooth also is engaged. Otherwise, the normal one will over-erupt. And this over-eruption will prohibit the second molar or seventh to mesially migration. Another point is that when you decide for extraction of sixes, you should definitely see the 8 buds, wisdom teeth buds, and that should be a normal bud as far as mesiodistal width is concerned, because most of the time you have a congenital missing of wisdom tooth, or you see an abnormal tooth, very small size of wisdom tooth. In that case, you should not extract the 6 anyhow. Usually, you do not see the 8 buds or wisdom teeth buds before age of 11 or 12. And this is the age when the second molars are erupted. So if you extract the 6, 7s cannot migrate mesially, just tips mesially. And that is a little bit mesially, tips only. Whereas if we can extract sixes very soon, almost 2/3 of the space, 7s can be erupted mesially. But at that age, we cannot see the wisdom tooth bud. The other point is that the sixes have the biggest mesiodistal width of crown, and the upper sixes have another extra root, which makes them the strongest tooth in the mouth. So we should try all of our best to preserve sixes anyhow. And whenever we are obliged to extract sixes, 7s should be protracted by orthodontists. It means that a long-term and very difficult orthodontic treatment should be done. Families should suffer from a high expense of orthodontic treatment, and the kids should suffer from difficulties of this treatment. The other point is that protraction of 7s to substitute 6s completely needs a very expert orthodontist to protect the sevens fully bodily. Otherwise, if they are tipped a little after the bonding, the seven will upright and the space will be open between distal of 5 or second premolar and mesial of 7, which is the place of food impaction. So I definitely insist on that to all of my colleagues, dentists, orthodontists, and others, not to extract sixes as far as you can. And thank you for your attention.